Today we're gonna talk about these three infections: tuberculosis, diphtheria, and whooping cough or pertussis. Whooping cough is name of disease. Pertussis is name of the pathogen that is causing those infections. But before we'll start talking about these specific infections, I would like again to remind you some things we passed last semester. Being more specific, I would like to remind you how we make difference between different shapes, how we keep them in mind, and how we use the genus name in order to keep them in our memory. Okay? So, talking about shape of bacteria, you know that we have spherical shaped bacteria, rod shaped bacteria, spiral shape, comma shape, and some intermediate types like cocobacilli, like oval shape, like L forms, or bacteria with irregular shape. We call them amorphic or polymorphic bacteria, but these are specific types of microorganisms. Now talking about rod-shaped bacteria. Please keep in mind there are two different words that are looking almost the same: bacteria and bacterium. But they have quite different meaning. What means bacteria? Bacteria is the general name, the general title for all unicellular prokaryotic microorganisms, right? All cells or living organisms are divided in two main groups: prokaryotes and eukaryotes. So to prokaryotic group we refer only bacteria. Now when we are talking about bacterium, it's a type of bacteria that has specific shape and specific cell wall structure. So from this point of view, we have three different types of rod-shaped bacteria, which is bacterium. This is what I started talking about. Bacillus and Clostridium. Bacterium, Bacillus, and Clostridium. Now, what is in common, and which is the difference between all of them? They have common shape, and this common shape is rod shape. Okay, so all of them are rods. Also, what is common between them is the cell wall structure. Bacterium, Bacillus, and Clostridium, all of them are gram-positive. What's the difference between them? Bacterium, non-spore forming. Bacillus, spore forming with a small spore, which doesn't affect the shape of bacteria. And Clostridium is a rod-shaped bacteria, spore forming with a big spore that deforms the shape of bacteria. So in Clostridium, spores could be situated centrally, terminally, subterminally, and centrally. So today we will talk about bacterium. And now please pay attention. Which is the pathogen which is the name of pathogen that is causing tuberculosis? Mycobacterium tuberculosis. Which is the name of pathogen that is causing diphtheria? Corynebacterium diphtheria. And only the last one is Bordetella pertussis. Now, tell me please, which one is gram-positive and which one is gram-negative? Mycobacterium, Corynebacterium, and Bordetella. Mycobacterium is positive. Corynebacterium is gram-positive. And Bordetella, gram-negative. It's finished with A, right? So first two pathogens are gram-positive, and they are rods. They're making part of bacterium. In their name, you can observe bacterium. It is the shape. And the last one is Bordetella, which has oval shape. And oval-shaped bacteria are called Coccobacillus. Very good. So, now paying attention to the other part of the name of bacteria, Mycobacterium tuberculosis. The first part, please keep in mind, not micro, not mayo, not mio, or something else. It's not related to muscles. It is not because it is microscopic, because all bacteria are microscopic. It's Mycobacterium. What means Mycobacterium? What means the first root myco? It also says about the morphological characteristics of the microorganism. Every time you try to understand the meaning of name of each genus of bacteria, you will realize that in most of cases, you will find there encrypted some information about their shape, about their structure, about their morphology, about their maybe some physiological features and so on. So talking about Mycobacterium, their main feature, their main morphological structure is outer layer of mycolic acid. Why it is called myco? Mycolic acid, which actually means wax. So it is a lipid, it's a waxy membrane that gives to this bacteria very high resistance in the environment. So it is highly resistant to the environmental factors, to humidity, to dryness, to different rays like UV rays and so on. And being specific, we also call these bacteria, we call them acid-fast or acid-resistant bacteria. Probably you remember it from last semester, right? We've been talking about acid-fast bacteria and the method of staining technique for acid-fast bacteria. We call it Seale-Nielsen staining. And by this method, we can detect acid-fast bacteria. So acid-fast bacteria, we have two main pathogens. Pathogen that will cause tuberculosis is Mycobacterium tuberculosis and few more species, and pathogen causing leprosy, Mycobacterium leprae. They are relatives, and they are causing these two different infections. Talking about diphtheria, Corynebacterium diphtheria. I don't have any specific connection to related to Corynebacterium, to the first part, but on two edges, Corynebacterium has volutin granules. Do you remember it? Volutin granules are characteristic, and on both ends of Corynebacterium, they are characteristic for Corynebacterium diphtheria. That is a pathogen causing diphtheria. So it looks like a girl, you know, with how you call it? Help me, please. Huh? Probably. Yes. When when you make it tails, right? Yes, tails. Thank you. Maybe somebody also. Okay. So like a girl with two tails on sides, you know. This is how I keep it in mind. Okay. So starting with the name of bacteria, we can move to each pathogen. When we make Sill-Nielsen staining, we can observe that there is a difference in staining between Gram staining and Sill-Nielsen staining, because there is a difference and there is something in common between them. What is common? Both of them are complex staining techniques. Gram staining is a complex staining and Sill-Nielsen is complex staining. In Gram staining, we apply purple and red dye, right? And in Sill-Nielsen staining, we apply red and blue dye. As a result, Gram positive, Gram negative are purple and red, or purple and pink, and acid fast, non-acid fast will be red and blue. Please keep it in mind, because on exam and on tests you will have, very often you are making this mistake. And you can, looking at the picture, misuse Gram positive, Gram negative with acid fast, non-acid fast. Because here we have red and blue, here we have purple and pink. So it's quite similar. It looks pretty similar, but they're absolutely different. So you can get a tricky question. Gram positive bacteria, which color has? Blue? Purple? And now, attention, it depends. You should pay attention to the way how the question is formulated. Because now I gave you a very general question without any specific data. So you shouldn't know the exactly correct answer, because I didn't give you exactly specific question. In this case, if you want to show that you understand what we're talking about, you give me extra questions. For example, I asked you, Gram-positive bacteria has, which color has Gram-positive bacteria? And you ask me, before or after staining? Okay? Why? Because before staining, all of them are colorless. They're transparent. There is no sense to answer such question. And if I say you before, you say They're colorless. None of them, they have any color. Okay, after staining. What do you say? If I say after staining, gram-positive has which color after staining? Which color has gram-positive bacteria after staining? Blue? Purple? And again, my question is too general. And you should ask me again. One more question. Which staining technique we apply here? Because if we apply gram staining, of course, gram-positive bacteria will get purple dye and purple color, and gram-negative will get pink. But if I ask you Seal-Nielsen staining, what do we have here? Seal-Nielsen staining we apply to Mycobacterium tuberculosis. So it is not gram staining. You shouldn't think here about pink or purple. You are thinking about red and blue, right? So in this case, gram-positive bacteria will have which color? Blue? Now you show how good you've been learning last semester, or how good you keep in mind. If bacteria is acid-fast, it would get red color. If bacteria is non-acid-fast, it will get blue color. So, if I ask you which is the color of gram-positive bacteria after applying acid-fast staining, we know for sure that Mycobacterium tuberculosis is gram-positive. We know for sure that if you apply acid-fast staining to Mycobacterium tuberculosis, it will become red. So you could say that gram-positive bacteria in this case will be red. But don't we have non-acid-fast bacteria which are gram-positive? Of course we do. So in this case, the answer on the question will be, while we apply acid-fast staining, we're not looking for gram-positive or gram-negative. We're looking for acid-fast or non-acid-fast. That means I can tell you for sure that acid-fast bacteria at the same time is gram-positive. But unless we apply to other bacteria around gram-positive, around acid-fast bacteria, unless we apply gram staining to other bacteria, we cannot confirm or infirm that others are not gram-positive or not gram-negative, because we're not looking here for gram-positive or gram-negative bacteria. Okay? So please keep in mind at least their colors, at least to answer to give correct answer on the exam. Because frankly, in my opinion, all pictures you have on the exam are gifts for you. If you have at least a little bit of logic and of knowledge from the entire semester. If you don't, of course, you will give pretty interesting answers for those pretty easy questions. So, Mycobacterium tuberculosis will cause an infection that is called tuberculosis. Overall, tuberculosis can affect basically any tissue in our body. Any tissue in our body. So we potentially could have pulmonary tuberculosis, we can have gastric tuberculosis, we can have bone tuberculosis, and so on. It can affect any tissue in our body. However, most of us, we are really used with tuberculosis in form of pulmonary disease, right? Which is the reason? Why it is the mostly common form of tuberculosis? It spreads easily. If you take the entire statistic of most of infection, all of infections, the highest spreading will have airborne infections. Not all airborne infections will cause respiratory infections, but all respiratory infections are airborne. Okay? So if we are talking today about tuberculosis, diphtheria, and whooping cough, we will describe their airborne transmission and the form of infection that affects somehow respiratory system. Which is also a common feature between tuberculosis, diphtheria, and whooping cough. All of them are spread through the air. Now, if you will try to apply gram staining to acid-fast bacteria, you will actually see nothing or almost nothing. Why? Because in case of acid-fast bacteria, gram staining or any other type or technique of staining will be useless. What makes Seale-Nielsen staining to be that special? Seale-Nielsen staining includes few steps. First step, we make smear fixation, as in any other case. After that, we put on the smear piece of paper, piece of filter paper, on which we put few droplets of carbol-fuchsin, which is a red dye. And after that, we put it on fire. For how long we put this slide on fire? 1 or 2 seconds, no more. But you look at the slide, and on the dye that is present on the slide, it should start giving steams, evaporating. But it shouldn't come to boiling. So bubbles shouldn't appear. As soon as steams are getting out, you take it out from the fire. You let it getting cool, and you put it on fire again in the same way. This procedure is repeated twice or 3 times. This way, you make sure what happens. Because heating is the mostly important part of Seale-Nielsen staining. What happens during this heating? Spores? Nothing about spores here. It is bacterium. It is non-spore forming. But the cell wall is covered, in case of Mycobacterium, its cell wall is covered with waxy membrane, with a waxy layer. This waxy layer, what is wax? It's a very solid lipid that melts while heating. So if you apply heating to the wax, you know it melts as candle or as any other substance or item made of wax, it melts. As a result, this waxy layer will get melting, it becomes liquid, and it allows carbol-fuchsin, this red dye, to penetrate inside of the cell. After you take it out and you let it cool, what happens? This wax becomes solid back. And when you put it after that in sulfuric acid, 5% solution of sulfuric acid, it washes out only the dye outside the bacteria. but waxy layer doesn't let sulfuric acid to wash it out from the inside of the acid-fast bacteria. However, it will decolorize non-acid-fast bacteria. That's the reason why in acid-fast bacteria we apply first heating and second sulfuric acid. And in the end, to differentiate acid-fast from non-acid-fast, we apply methylene blue dye, which will stain the rest of bacteria. And after that, we don't decolorize it anymore. As a result, we'll have two groups of bacteria. Some of them will be red, and you confirm it is acid-fast bacteria, and some of them will be blue. That means non-acid-fast bacteria. Is it clear? Okay. But there is a problem. Not every time you will find the pathogen itself in patient. Let's imagine you have a patient with some issues, which are symptoms of tuberculosis. If we are talking about pulmonary tuberculosis, it starts with affection in the lungs, and it makes some kind of capsules surrounded with calcium in case of good immunity. So if Mycobacterium gets in your lungs and you have good immunity, our body produces some extra calcium that surrounds the bacteria and doesn't let it go even forever or for a very long period of time. As soon as immunity will be decreased, or as soon as the person will get infected again and immunity will be decreased, this infectious process could restart. So it will produce some symptoms related to respiratory tract. Being more specific, coughing. How we make difference between bronchitis, pneumonia, classical respiratory infections, and pulmonary tuberculosis? First of all, you pay attention for how long the person is coughing, because most of respiratory infections will be done in a few weeks. Starting with 1 or 2 weeks, talking about flu, coronavirus, or any other acute viral respiratory infection. Either talking about bacterial respiratory infections, we are talking about 2, 3, 4 weeks, no more. And if in these 3, 4 weeks the person didn't die, because bacterial respiratory infection is actually a really dangerous issue, which leads you to hospital. So if you get in hospital and you've been treated, of course, with antibiotics, and during these few weeks, first, you didn't die. Second, you get well, it's a common bacterial infection. But if during more than 1 month the coughing is not passing and most of treatments are not working, it should be the first alarm. Second alarm is person gets so tired, fatigue, nocturne sweating, the person sweats during sleeping, not all the time with fever, sometimes with fever, sometimes without. and is losing weight. Plus, for sure, some social features, some social background. Probably, in most of cases, the person will be with decreased immunity, maybe with some alcohol or drug or smoking addictions. Maybe the person is from socially vulnerable layer, like person with low income, person with bad conditions, home or generally homeless person, which cannot afford good clothes, good food, enough food at least, and any other things that will influence directly and indirectly will influence the comfortable life and good immunity. So if the person fits to all of these descriptions and has coughing more than 1 month and has nocturnal sweating and losing weight and becomes so tired more and more, extremely high chance it's tuberculosis. Now, fortunately, tuberculosis doesn't spread as fast as flu, for example. Well, it is not enough only to sit for a few minutes or even for a few hours near a person who is infected with tuberculosis, who is coughing and so on, in order to get infected. You need a really long and close contact to the person, because if the dose of infection is low and you have high immunity, or if you have high immunity but the dose of contamination is high, in this case, you have a chance to get infected. So a long exposure, big dose, and low immunity. These are requirements for people to get infected and to get sick, because being infected not equal being sick. When you are sick, when you have symptoms. Sometimes we can have not only pulmonary tuberculosis but extrapulmonary tuberculosis. Sometimes it can migrate into lymphatic nodes, for example. This is really a common issue in case of children who are living with parents who are infected with pulmonary tuberculosis. They can finally get infected, and the first manifestation will be tuberculosis of intrathoracic lymphatic nodes. Such people, infected patients are not dangerous as a source of infection, because even if they could have some symptoms from the respiratory tract, but the pathogen itself is situated inside of lymphatic nodes. It is not in lungs, it is not erupted, and it is not eliminating in environment with coughing. So danger represents only person with open form of tuberculosis. Open form of tuberculosis means pulmonary tuberculosis with destructive process. That means the person already coughs with blood, with tissue particles, with sputum, and so on. If the person has such symptoms, there is a pretty high chance the person has open form of pulmonary tuberculosis. Now, what complicates diagnosis and treatment of tuberculosis? First of all, just as I told you, you cannot take few samples and put it under the microscope and make Cell-Nielsen staining in order to see do we have acid-fast bacteria or not? Because in order to find the pathogen, you need to cultivate it first. You take a sample, you put it on culture media, you wait until it grows, you take a sample from colonies from culture media, you put it on the slide, you make Seal-Nielsen staining, and after that you can see is it acid-fast or not. But here's the problem. Mycobacterium tuberculosis grows really slow, extremely slowly. For example, if you have staphylococcal, streptococcal infection, or any other common infection, the mostly spreaded infections, you take a sample, you put it on culture media. In most of cases, tomorrow it will give you growth. If not tomorrow, day after tomorrow. No longer. Most of bacteria are growing really fast. Talking about tuberculosis, talking about Mycobacterium generally, it grows really slow. That's the reason incubation period is very long in both. Tuberculosis, in leprosy, incubation period could be even longer. In leprosy, incubation period could reach up to 40 years. But in case of tuberculosis, it could be a few months. So imagine that in order to grow, to cultivate Mycobacterium tuberculosis on culture media, it could take over 30 days. Usually 30 up to 40 days you need to grow it on culture media. So you don't have time first to make cultivation, after cultivation to make test for sensitivity for antibiotics to check is it resistant or not to antibiotics. So we do it at the same time, cultivation and test for sensitivity. For this reason, we have Levenstein-Jensen culture media. Levenstein-Jensen culture media is applied specifically for tuberculosis, and it includes a line of tubes. The first tube will contain only Levenstein-Jensen culture media, and every next tube will contain the culture media plus antibiotic, culture media plus antibiotic, independent on which antibiotic we are going to give to the patient. We check each anti-TB antibiotic for this sensitivity test. So the result we will get after 1 month. But now we should start giving the treatment. What should we do? In the beginning, we apply combined treatment with few pathogens at the same time. Now, if we already know the person from whom a patient got infected, probably we already know which is the strain the person got from the previous one. And in this case, probably we know for which this pathogen is resistant, for which antibiotic this pathogen is susceptible. In this case, we have some extra time and we can start applying the correct treatment. But if we don't have, if it is the primary patient in this chain, in this case, we need to wait until we find out which antibiotic is the mostly efficient for this pathogen, and in the end of the cultivation, we will only confirm that we are going on the right direction, or we will change it with another microorganism. But you never start treatment with all types of antibiotics. We have first-line treatment, we have second-line treatment, and we have reserve. All the time when you are making lab investigation, when you prescribe lab investigation for each infection, please think about it. You should have all the time first-line treatment, second-line treatment, and reserve. If you will do it all the time, in most of cases, you will never fail your treatment. If you will do your best to never make sensitivity test, such idea as first, second line treatment and reserve treatment will disappear from nature. Because most of pathogens will become resistant to most of antibiotics, which will reduce from your choice in treatment. This is why lab investigation, I will repeat it again and again from lecture to lecture, lab investigation will save your time and will save your money. Don't you think that if you will make lab investigation and it will only confirm your presumptions, you will waste your time? No. You save, it is not wasting, it is investment in future generations. Of course, if you don't care about future generations, it is a different thing. But me, for example, I would like my children, if they will like my profession, I would like my children also to work in this field. I wouldn't like to complicate their life because it's gonna be complicated anyway. So if you are thinking about generations to come, please think about it. Lab investigation is all the time investment in future generations and in saving money and time in future. You will waste a little bit, you will invest a little bit more time, and you will save much more time and much more lives, by the way, which is not the last topic in our specialties. So, bless you. So, what is also important? You start treatment with antibiotics, and here you should keep in mind since it is really aggressive and really complicated and long growing microorganism, as slow it grows, as slow it is treated. As slow mycobacteria grows, as slow it is treated. As a result, please keep in mind, you don't have too much time for treatment of your patients. And a lot of patients will finally prefer ambulatory treatment. That means in the beginning they stay in hospital, they get their treatment. After that they feel better. And keeping them in hospital and providing them with treatment in hospital, it's a really big financial and material burden for both the healthcare system and for the patient as well. And as a result, a lot of patients are going home for treatment. And here is the mostly vulnerable place. Because in case of tuberculosis, there is a specific type of strategy that is called DOT, which means directly absorbed treatment. So it is extremely important in case of tuberculosis to apply this directly absorbed treatment, which means that every single pill of antibiotic should be swallowed, should be applied in presence of medical staff. If you let go home those people with tuberculosis, please keep in mind, most of them, not all of them maybe, but most of them are making part of socially vulnerable layers of society. That means they have extremely low level of responsibility in everything, including their own health. such people are that used to be sick. They come in hospital only few minutes before death. And they stop treatment as soon as they start feeling a little bit better. So in order to reduce abandoned treatment in case of tuberculosis, because it is 100% as soon as the person will abandon the treatment, the 100% warranty, the person will transform its pathogen into a multi-drug resistant strain. Because in the beginning we already applied more than 2 types of antibiotics. And multi-drug resistance means resistance to at least 2 antibiotics. That means next time the person will have acutization, next time the person will get worse with this untreated infection. The person will come to the doctor, and what will happen? We'll have to look for a few extra antibiotics, because first few antibiotics will be useless. You will not be able anymore to apply them. This is why it is extremely important to provide patients with directly absorbed treatment. Otherwise, it could sound weird, but it is better to not treat, but treat and stop. Because if you will treat and stop, it is almost equal with killing the person, one. And second, letting this person to spread this multi-drug resistant strain. Because if the person spreads susceptible bacteria, at least you have chance to treat those whom the person will infect. If the person will spread resistant strain, it will create a lot of issues to both the person itself and people whom he or she will infect. Talking about prophylaxis, do we have vaccine against tuberculosis? Yes and no. Why yes? Because here it is, BCG vaccine. BCG vaccine is vaccine provided in order to decrease mortality caused by tuberculosis. But why we cannot say 100% we have vaccination and prophylaxis against, specific prophylaxis against tuberculosis? Because BCG vaccine is made of Mycobacterium bovis. And the mostly spread pathogen that causes tuberculosis in humans is Mycobacterium tuberculosis. These are 2 relatives, which Mycobacterium bovis is causing tuberculosis among cattle. It is also able to infect humans, but it doesn't really spread too much among humans as much as Mycobacterium tuberculosis. So they are relatives, but Mycobacterium bovis is quite lighter. It is not that aggressive as Mycobacterium tuberculosis. And at the same time, do you have the sign of vaccination, BCG, on your left shoulder? Do you know why? Check it out. Maybe not everyone, but because it doesn't manifest exactly the same way in everyone, but in most of people, at least one sign will appear. Some people have even 2, because first one is applied in first week after birth, and the second one is made at 6 or 7 years old children. So at least one of them will give you this reaction. It is intradermal injection, intradermal vaccine, and since it is the only vaccine that produces such effect, by the way, and it is not that dangerous for us. Now guess why we don't use Mycobacterium tuberculosis as a pathogen for vaccination? Because it is dangerous. And here is proof that medicine doesn't provide us with anything that is really dangerous for us. If it would be inoffensive, we would be vaccinated with Mycobacterium tuberculosis, but not bovis. One more reason why I trust vaccination. Now, since it is not exactly the same pathogen that is causing infection in humans, its target is not prevention of infection itself, because it is not, just as I told you in the beginning, it is not that complicated. Excuse me, it is not that easy to get infected. But the main issue is if children are not protected, at least somehow, at least with quite similar antibodies, there is a higher chance, if a child gets infected in young age, it's a higher chance for a more aggressive form, and as a result, mortality, high mortality among children. And you can observe that not every country has in its national immunization program BCG vaccination. Usually it is related to developing countries or low-income countries, but not to rich or high-income countries. It is not related to them because tuberculosis also is known as poverty disease. You need to fit to a lot of features or categories of population in order to be in high danger to get infected. As a result, for prevention of children's mortality in the entire country, we have such vaccination. But the best prevention, of course, is doing something for you. If we are talking about the entire country, social programs, increasing quality of life, increasing possibilities for all categories of population, and talking about each person separately, being active, being useful, trying to do something in your life in order to not have lack of anything you really need. And actually every healthy person, at least if you have your limbs and you're able to wake up and go every day somewhere, and if you are able to go abroad and to make some studies, probably your situation is not the worst one. As a result, the best prophylaxis of tuberculosis, even if you are living among people with different habits and different lifestyle and different health issues, the best option is being positive, being active, being useful, trying to do your best all the time. So it is specifically about tuberculosis, it's not about vaccination. So vaccination is a good option, but extra option, not the main one. Talking about other infections like diphtheria, pertussis, like measles, mumps, rubella, and so on. Infections also spread it among children. There is no better prophylaxis than vaccination for those infections. For tuberculosis, lifestyle is really important. Diphtheria is another pathogen that is spread through the air, and it should be differentiated with tonsillitis. Who had ever tonsillitis? Sore throat. Probably everyone. So tonsillitis is caused by Streptococcus pyogenes. We've been discussing it last week. Streptococcus pyogenes is spread everywhere, and probably all of you or most of you have in oral cavity Streptococcus pyogenes, and as soon as your immunity reduces, there is an infection that could reappear. Talking about diphtheria, it affects the same region, but it is more aggressive, it is more toxic. However, Streptococcus pyogenes is not the light pathogen. It has high level of ability for hemolysis. As soon as it gets in our bloodstream, it will produce a lot of issues because of hemolysis. This is why Streptococcus pyogenes is also called beta hemolytic Streptococcus, which makes part of group A. So Streptococcus beta hemolyticus equal Streptococcus pyogenes. Beta hemolysis is the strongest form of hemolysis. That means destruction of erythrocytes. But Corynebacterium diphtheria is really dangerous because of its toxicity. Corynebacterium diphtheria is able to produce exotoxin, which is the main pathogenicity factor, and it produces huge inflammation process around the middle of inflammatory process. As a result, the entire upper airways and the neck will start swallowing, and symptoms will be similar with tonsillitis, but much stronger. As a result, a child could even die because of asphyxia, because of blocking of airways due to inflammatory process. How you make difference between tonsillitis and diphtheria? You will see it on your devices, but if we try to see it a little bit here, in case of tonsillitis, you will see a lot of whitish spots on tonsils. In case of diphtheria, it will be a big pseudomembrane, whitish pseudomembrane that is very hard to take out of there. Sometimes it is unilateral, sometimes it affects both sides. Now, the main reason why it is extremely important to vaccinate children against including diphtheria, not only other infections, because when the inflammatory process starts, it's really hard to undo it. And now imagine your child is not able to eat, drink, and finally even breathe, just because you've been scared of 1 or 2 days of fever because of vaccination. Yes, vaccination sometimes produces such symptoms like fever or pain in place of injection. Two weeks ago, my youngest daughter have been vaccinated. 2 injections intramuscular in her tiny feet, in her tiny legs. Do you know how painful is it? I don't know for whom it was more painful, for me or for her. But she's been crying a lot. And after that, 2 days of fever. We've been crying as well. Because I understand it is really painful for parents to see even 1 or 2 days of fever for their children. But as soon as I know from what I protect my children, I would better let her suffer this than this. And I will resist somehow. So it is really important. Now, some parents are saying, we are not getting vaccinated, we do not vaccinate, and we are life and kiki. Everything is fine. Really? Happy for you, but it is not because you are that smart. It is because you don't have any source of infection around you. Because most of other children are vaccinated. Since most of them are vaccinated, the source of infection doesn't circulate around you. It is not because you are smart, it is because you didn't get it yet. That's it. Now, as soon as this information spreads from parent to parent, we didn't vaccinate and we are healthy. We didn't vaccinate, we're healthy, we're fine. So you shouldn't vaccinate. And after that, they start sharing stories like, immediately after vaccination, I know the person, immediately after vaccination, their children became autistic. Come on. I love it. I love it. I hate it. So, why? About 100 years ago, almost, have been proved that autism is genetic disease. It's genetic disease with symptoms appearing in period of vaccination. Autism, its symptoms are able to appear only in period of vaccination and after vaccination. That's it. Nothing else. It's genetic genetic disease. That's it. So do I believe that there are children who've become sick with autism immediately after vaccination? Yes, I believe it. If anyone will tell me that, can you see this autistic kid? Immediately after vaccination, I believe it. Because I know their region and I know the period of time when it starts manifesting. That's it. But there is one more thing they don't want to acknowledge, is if they wouldn't vaccinate, this autism anyway would appear. Because, surprise, there are a lot of autistic kids without vaccination. How you explain it? How you explain it? It's ignorance. It is lack of information that spreads, unfortunately, even among doctors sometimes. And if in other infections you can somehow to use, we call it social immunity. What does it mean? Everyone around you is vaccinated, you are not vaccinated, You have social immunity. You use social immunity. That means that everyone around you has immunity and there is no way for you to get the source of infection. There is no source of infection around you. It's impossible in case of diphtheria because other vaccines, they have antiviral or antibacterial effect. Diphtheria vaccine, antidiphtherial vaccine, is a toxoid. What means toxoid? Toxoid is a modified toxin taken from diphtheria. It's diphtherial toxin that have been modified in that way with reducing its pathogenicity and keeping its immunogenicity. So it is an inoffensive toxin you introduce in your body, and your immune system starts producing antibodies against diphtherial toxin, not against diphtherial pathogen. Other vaccines could have antibacterial or antiviral effect. As soon as you have immunity against this infection and this pathogen gets in your body, your immune system kills the pathogen. When you are vaccinated against diphtheria, antidiphtherial immunity doesn't kill the Corynebacterium diphtheria as soon as it gets in your body, but it locks all the toxins it produces. As a result, me as a vaccinated person, by the way, how old are you? 20. Most of you are 20. Did you make DT vaccine this year? Diphtheria and tetanus. Because from the age of 20, every 10 years, every person should make vaccination against diphtheria and against tetanus. So it is not only about children, it is also about adults. So I did it already twice from that period. Bless you. Think about it, because you can be immune, you can have protection against diphtheria, and at the same time you can be source of infection. This is why it is strictly forbidden for children without vaccination to go to kindergarten and to school. Why? Because there is a small chance that we will have few children who have contraindication for vaccination. They need social immunity. Social immunity should be preserved for those who cannot get vaccinated, who would like to be vaccinated but they cannot. Fortunately, most of people do not have contraindication for vaccination. Keep in mind, contraindication for vaccination for long time, lifelong contraindication is immunodeficiency. Innate immunodeficiency or give me the word. Acquired. Thank you. Sometimes you lose the mostly regular word. So it can be innate immunodeficiency, it can be acquired immunodeficiency. But if the person has immunodeficiency, you don't vaccinate the person. Doesn't make sense. In any other case, the person is to be vaccinated. Any other issue is not lifelong contraindication. Some issues could be temporary contraindications. For example, right now you're sick. Don't vaccinate right now. Do vaccinate later when you get healthy. If you have chronic infections or diseases, don't vaccinate in the moment of acutization. Vaccinate after you get treatment, after you feel better. That's it. No other contraindications. So it is really important to vaccinate against everything that is given to us. And the last pathogen, Bordetella pertussis. The pathogen Bordetella pertussis is causing a specific disease. You probably heard it. It's called whooping cough. In some languages, for example, in Romanian, this disease also is called donkey cough. What is donkey? Yes. Uh-huh. Do you know how sounds donkey? Do we have here anyone who could yes. Anybody? Because actually the cough that goes out of children who are having this infection is really similar. Do you have here sound? Don't you know? Yes, we do. Look. Still exhales. Still exhales. Can you hear this sound? So in the beginning, when you start describing whooping cough and you are saying about donkey cough, it really sounds funny, isn't it? Until you can see it. Because actually what happens when a child has this whooping cough? The irritation caused by Bordetella pertussis on the level of upper and middle respiratory ways is that strong that baby doesn't succeed to inhale. It only exhales during coughing. So it sounds like of course, baby will produce this sound a little bit lighter because of small larynx, but still, the reason of the sound is there is no way to exhale anymore, and actually the child is not able to breathe. So when I can see something like this, now imagine yourself as a parent who decided to not vaccinate your children. saying, I will never allow my child even having fever, even I will protect my child against anything. Come on. You cannot stop your child licking floor or shoes or something else. You cannot stop your child, you cannot control your child for doing anything. It's impossible to prevent any risk. As a result, by vaccination, you remove your child from a huge risk to a small one. And the real love is with minds, with brain, not bypassing. Because it is really important to understand. You take responsibility on the life of this little child. You are the person who will give the life, and you are the person who decides how long this child will live by giving or not vaccination. And maybe you even decide the way how the child will die in the moment you refuse vaccination. It's really important. So every time you're thinking about, isn't it dangerous? Tell me please, do you know any safe procedure in medicine? Any 100% safe procedure in medicine? Every time you get in hospital, every time you make any procedure, even a small injection, even anything, perfusion with physiological solution, with saline solution, perfusion, you sign accept. You sign that you've been acknowledged with every risk that potentially could happen. If you go for surgery, even more. You sign and you write down with your own hand that I've been informed that could happen. Bleeding, infection, even death, everything could happen in surgical ward. Everything could happen. So I understand all risks. I understand all benefits. I've been explained about everything, and I let doctors to do everything they decide to do. This is why when some doctors are asking me while vaccination process, because I'm in charge on vaccination in our hospital and not only, so when some doctors are asking me, would you sign for me that if something happens to me, you're gonna be responsible? Dear colleagues, are you doing something like this to your patients? So you are requiring me to do this? Meanwhile, every day you are making even more dangerous procedures to your patients. But you realize the benefit of this procedure is much higher than the danger. The same thing here. So please, we shouldn't live in an imaginary world where everything is fine, everything is good, nobody dies, and everything we are doing is 100% inoffensive. You should realize that you are living in an actual world full of dangers and full of issues, full of death and suffering. That's the reality. This is the reason you came here. To reduce it a little bit. A little bit, not too much. Any questions?